Well, welcome everyone. Welcome to this public lecture organized by the Ottawa Network for Borderline Personality Disorder. This lecture is being recorded on November 19th, 2025, and our topic this evening is the support for addictions and mental health offered by Rideauwood. My name is Floyd Kelly. I am a volunteer Family Connections course leader and serve as the president of the ONBPD board. The Ottawa Network for BPD is a federally incorporated registered charity in Canada, consisting of volunteers. There's about 25 volunteers now who deliver the evidence-based Family Connections training program to families and loved ones of people with BPD. I'm also delighted to introduce Danielle Langlois, our CIO and fellow Family Connections course leader, as well as our Director of Communications, Nicole Barnes. During tonight's lecture, all attendees are set to listen only mode and view only mode, so cameras and microphones are turned off. But if you would like to ask a question, just use the Q&A tool to send your question in writing. At the end of the presentation, we'll read your questions to our speakers. Note that you can remain anonymous by checking the little anonymous checkbox, and we ask that you don't include any confidential, private, or identifying information in your question. Material presented in this webinar should be considered as information only and not advice. And now it's my pleasure to introduce you to this evening's speakers. Amanda Neilson is Manager of Clinical Practice at Rideauwood, and together with Algonquin College created the Umbrella Framework, a harm reduction framework for post-secondary education. She's been providing trauma-informed care for people experiencing chronic stress and trauma, as well as substance use for over 20 years. Connor Matthews is a registered social worker who has been working in the field of mental health and addictions for about 5 years, and last year joined Rideauwood in partnership with CHEO's neurodevelopmental health and outpatient mental health departments. And finally, Stanley Spencer is an addictions counselor who's been with Rideauwood for over 3 years with a background in social work, addictions, and housing, and currently pursuing a master's in counseling. Please join me in welcoming our speakers this evening. And now, Amanda, I would like to hand it over to you.
Thank you so much, and welcome everyone. I am going to put a timer on because, as Spencer and I were talking earlier, we could we could be here all night talking with you folks. So, let me go ahead and share my screen, and we will get in it. Oh, it's being a little laggy. Thanks for your patience, folks. There we go. So yeah, tonight we're going to share a little bit more about Rideauwood, our philosophy of care, and our programming. So I have the pleasure of talking a little bit about our philosophy of care. And so I'm going to invite you folks just to take a look at well, I'll introduce you actually to Olga Believa. She's a drug policy reform activist from the Ukraine. And just take a look at what her shirt says. Nice people take drugs. And, you know, just how does that land on your system? What comes up for you? Whatever comes up for you, where did you get that idea? How do you know? What have you been told? Notice if any of that changes if the shirt said nice people take caffeine, nice people take alcohol. Does it shift at all if the shirt said nice people take cannabis, cocaine, crack? Does anything shift if it were to say nice people take opiates or fentanyl? And this is just an opportunity for us to, take a moment to recognize that we all have beliefs around substance use. We all have beliefs around, different substances. And we're not here to say, what's bad and what's good. There's lots of really good reasons why we have those understandings that we have, have had experiences that have informed those understandings. Excuse me, informed our understanding. And just to say, it can very much feel like there's a hierarchy or there's certain stigma with some substances and not others. So yeah, this is a moment just to kind of tune in to like, what are we all sitting with right now? this is a bit of a level setting just to talk about the spectrum of use. I want to really acknowledge that there's lots of people who don't use, that they've never used, that they have used substances and it wasn't for them. They've used substances and it's become a problem. They've gone back to not using. But just acknowledge that you know what? There's a population of folks who don't use. And I say this because when I was working the school-based program at Rideauwood, I would work with youth who'd be like, Amanda, everybody uses. And I'm like, well, everybody you hang out with uses, but that's not everybody in your class or everybody in your neighborhood or everyone in your school. And to just acknowledge that lots of people are functioning well in the society and not using. However, we also know that many folks, particularly teens, will experiment, and experiment is purely out of curiosity. And when we think about teens in particular, oh man, I don't know about you folks, but I had adults telling me drugs are bad, don't do drugs, just say no. You know, the idea of if I were to use cannabis, I would do worse in school. I wouldn't pass my classes, I wouldn't get my diploma, and then I wouldn't be able to get a job, and then I would die in the streets. And then I had people I knew, people I liked, my cousin, my older siblings, my next door neighbor, my best friend who went and used cannabis. And not only did they not implode in that exact moment, they talked about how good a time it was. And then they continued to maintain their A grades. So experimentation for many youth is about trying to figure out what is real for them, right? Trying to exercise agency, and choice and to have their own experience. So we know that, experimentation is about trying substances or a certain behavior for a few times and it's purely out of curiosity. Now, experimentation is the only stage that we cannot stay in. Once, a person uses for a period of time, they can't say, no, no, I'm still experimenting. They either go back to no use or they go to occasional or social use. Occasional social use is where not a lot of time, not a lot of money is spent on getting it, using it, or recovering from it. Though people can experience problems if they're using occasionally or socially, it's not that there's zero risk. But when they experience something that they're like, ooh, this is not jiving with me, they're able to make changes to their use and do so quite easily. Um, and so the impacts are less, right? They're not in a position where it's habitual. And so habitual is another stage where, and I will say, people can use occasionally and socially for the rest of their lives. People cannot use for the rest of their lives. People cannot stay in experimentation for the rest of their lives, though. So habitual, our brain loves shortcuts. And you know what? When folks are using habitually, it can be really problematic and it cannot be really problematic. But more time, more space is spent in using it, getting it. It becomes maybe how a person starts being able to function. As in, the only way I can get out of bed is if I wake up and use cannabis right away, or the only way I can rest after work or after school after school is taking alcohol, and that there's this bit of a shortcut in the brain of like, well, this is what we need to do. It becomes very automatic as habits do. And then problematic. How do we know it's causing a problem? Well, how do we know it's problematic? Well, it's causing problems. And this can be in many different areas. Having worked with the folks for as long as I have, there are some youth and adults that I've worked with where they're just uncomfortable with it, right? Their grades are fine, their work is fine, their relationships are, everything is okay, but they're not happy with it, or they want to make changes and are struggling with it, all the way up to folks where it is interfering significantly. And what the difference is between occasional social use and, let's say, problematic use is that despite it causing problems, it's it's a real challenge to make those changes. So again, takeaways for me on this slide is that not everybody who uses substances will use ongoing. Not everybody who uses ongoing, will it be a habit? Not everybody that it's a habit for will be problematic. And so just kind of really holding all of that. Because our understanding of the problem determines our solutions. And what does this mean? Well, really quickly, Dr. Stuart Ablon, who has nothing to do with substance use at all, is actually a researcher in the States. And what he was told, what he was told to do, what he was tasked to do, was figure out why children misbehave and then make them behave. Okay, so he did a lot of research, and what he discovered is that there was this underlying understanding of why children misbehave. And that understanding was children behave because they want to. Therefore, children misbehave because they want to. Well, when that was the understanding of the problem, then the solution, which makes sense, is punish the behaviors you don't want. So you will make the child want to behave, and reward the behaviors you do want. So you will make the child want to behave. But in his research, what he discovered was children behave when they can. And if they're not behaving, if they're not able to follow the rules, if they're struggling within a structure, it's got nothing to do with want and everything to do with they don't have the skills, the abilities to do so. And when we understand the problem as, oh, this person's missing skills, then the natural solution is, well, let's teach them. And so this is where collaborative problem solving was born. And collaborative problem solving is all about how do you, like being able to figure out when a child's misbehaving, what skill are they missing, and how can we support them in learning that? And when he instituted collaborative problem solving, all of a sudden the misbehavior went down dramatically because children were getting what they needed so they could behave, because all children want to behave. So what has this got to do with substance use? Well, if we understand that the problem is drugs, oh boy, then we put everything into how do we get rid of drugs? How do we, and oh, just a note, excuse me, when I say drugs, it is also including alcohol, right? So alcohol and other drugs. Um, that is an important distinction of that alcohol is a drug, and often in our language we like to separate it out. But if we understand that alcohol and other drugs are the problem, then we practice prohibition. We saw that in the 1920s and 30s. We practice criminalization. We try to get rid of the war on drugs in the States, which is definitely filtered up to Canada. If we understand that the problem is people who use drugs, well, then our natural solution is to get rid of those people. And so this again is where we see people who are criminalized for using, who are disadvantaged for using, disconnected. We try to get rid of those people, them over there. But what if we understood that problematic substance use was a survival skill, a coping skill, that it was a solution to another problem, that it was actually a result of the human experience with limited tools? Well, then all of a sudden, our solutions are plentiful. I'm going to talk a little bit more about that. Thank you. So yeah, this ideas of like mental noise and trying to solve a problem and trying to manage some things that are going on inside that are unmanageable. And just to say that we all have fundamental human needs, everything from the physiological needs to safety needs. And when I think safety, I think security, love, belonging, esteem, self-actualization. And if we had more time, I would get you to kind of brainstorm like, what does this look like in real life? And it's, love, belonging, acceptance, achievement, functioning, rest, relaxation, emotional regulation, being able to disconnect. Like these are all things that all of us need. And for lots of different reasons, whether it's mental health, whether it's trauma or chronic stress, we might not get those needs met in the way that works for us. But that doesn't mean we stop looking for those needs to be met. And if we're experiment with something like substances, or as Dr. Gabor Mate talked about, it could be gambling, it could be gaming, could be internet. If we find that those activities meet those needs, oh man, Like, whew, we're going to do what works over and over and over again. And here's the thing, drugs work for all of these fundamental needs. When they're not able to be met in other ways, or that person hasn't found another way to meet those needs. And so then when we go, okay, as a human being, if something works for us, of course, we're going to do it over and over and over and over again. And for the most part, alcohol and other drugs don't necessarily cause problems right away. It's a little bit later on, or there's a buildup. But at that point, if that's the only thing you know how that's going to work for you to emotionally regulate, to have freedom from pain, both mental and emotional, giving up the substances means giving up having that freedom from pain, having that safety and security. And so we can start really understanding why it might be so challenging for people to make those changes. Dr. Gabby talked about trauma, and when we looked at this definition, trauma is when we have encountered an out of control, frightening experience that has disconnected us from all sense of resourcefulness, safety, coping, and love. Well, don't those just sound like fundamental needs? So even if we had our fundamental needs met, we can experience something that disconnects us from that. And so again, we're seeing, ooh, a person's trying to get that back. They're trying to be okay. So here at Rideauwood, we practice what's called trauma-informed care and trauma-informed. So all of our programs are audited to ensure that they reflect trauma-informed care. So trauma-informed care is trauma awareness, and that sometimes trauma can be a word that feels too big for some folks that doesn't resonate, but chronic stress does. So it's just that understanding that what we've experienced in the past, trauma or chronic stress, can impact our present. It is very much strength-based and skill building, kind of going back to that collaborative problem solving, right? Like, what if we could teach the skills so people could do well? Emphasis on safety and building trust. We do not expect that from folks that come and see us right off the hop. We understand that that's a process and that there's opportunity for choice, collaboration, and connection. And we also use a harm reduction approach. And so here at Rideauwood, we're not giving out safe needle supplies. We're not a safe consumption site. However, all of our programming, it comes from harm reduction principles, utilizes harm reduction principles. All our staff are trained on harm reduction principles because when we break down the principles, we're looking at there's an understanding that small gains will increase over time. Change is challenging, so we start with small incremental steps. We accept that there are benefits to use, as we've seen Gabor Mate talk about. Focuses on reducing the harms associated with the substance use rather than focusing on trying to get people to stop or change the use itself. And again, provides individuals with choices, options, and promotes personal autonomy and decision making. And what we can we can see that there's some very significant overlaps between trauma-informed care and harm reduction, and this understanding that harm reduction is trauma-informed care, right? And again, here are the principles: emphasis on safety building, trust, connection, options, choices, collaboration, strength-based and skill building, awareness that change is hard and small gains increase over time, and aware that the impacts of trauma or chronic stress and how many people experience benefits to ongoing use as a way of managing that. And so I am trying not to take up too much of my co-facilitator's time, but I will just speak briefly to the programs, the adult programs and services, and then I'll pass it on to Connor, who will talk about our youth and young adult and school-based programs. So our adult program, so first of all, Rideauwood serves folks that are 12 years of age and older. All our programs are free. There's no cost associated to them. We serve the Ottawa and surrounding area. And so our adult programs consist of the urgent substance use treatment. So this is individual counseling for folks who are experiencing acute impacts of their use. So this is folks who may have some suicidal ideation, who are have precarious housing, work in construction. That's a high risk population. So these folks, we try to get to see them once they have done an intake as soon as possible. Our adult treatment program is a group-based program and it supports participants in their individual goals, but in a group format. So we have folks who may be reducing, moderating, or abstaining from substances, and it's through structured group counseling and personalized support in the way of individual sessions. Group programming, for example, is 12 sessions. So it's once a week for an hour and a half for that time period, and then a number of individual sessions on top of that. We also provide a group treatment for folks who identify gambling as problematic, and so we do prevention, education, treatment services to address the problems of gambling, helping people increase their understanding of the nature of gambling and seeing how it affects their lives and the lives of others, to set goals, learn the skills. We're seeing that again to support the change that they're seeking. And the other adult program that we have is we have an Ottawa Drug Treatment Court. Now, this is specifically for folks who have been charged as a result of their substance use, and they receive treatment. It's a year-long program. They receive treatment tailored to their needs, and they are supported in going to court every week. They have group counseling and individual counseling, and so clients are referred directly from the justice system. And at the end of the presentation, we'll talk about how other folks that are not involved in the criminal justice system can access our program. But without further ado, I would like to pass it on to Connor.
Thanks, Amanda. Hi, everybody. As Amanda has said, my name is Connor, and I am one of the team members for the youth and young adult portfolio at Rideauwood. So at Rideauwood, we typically split up all of our services into different categories, and the YYA team is one of the larger ones, I would say, just because we have a very large portfolio and very many different programs that are involved within it. So I'm going to talk to you about all the ones that are involved for youth today. So at the start, we have your very standard youth and young adult program. So we have two different streams when it comes down to our youth and young adult portfolio. So this would be anyone from age 12 to give or take about the 25 years of age, depending on specific circumstances and what is going on and how long they've been with us at the program. And we're one of only one, if I'm not incorrect, that serves youth at that specific age within the area the way that we do for free because of specific funding that we have for it. And so with this program, we try to identify any strong needs that might be there for clients, including meeting them where they're at and supporting them through virtual and in-person one-on-one counseling sessions. The goal is to also have a group for youth as well in the future. However, that is still in the works and something that we want to bring back. We did have at one point, but unfortunately had to crawl back during COVID times, but something we're looking to bring back. Another aspect we have is the youth justice program. So very similar-ish to the DTC, the drug treatment court that Amanda had previously mentioned. We do have a counselor who does take visits up to the youth justice centers and working with kids who are specifically struggling with the justice system. And we have specific counselors on our team that help to support not only the addiction or substance use concerns that are present, but also help to navigate the piece a little bit as time goes on while they're doing that process. Along with that, we have many collaborations with One Call, One Click and Kids Come First, as well with CHIO, and I will get to them soon enough because I have a whole page dedicated to them because that's specifically what I do. But we also have other partnerships with many different agencies around. So St. Mary's is just one partnership that we hold where we have one of our counselors who provides remote or in-person individual counseling and substance use support to clients of St. Mary's who specifically are pregnant or parenting people at St. Mary's. And so we have counselors on our team that help in all of those different aspects. Amanda, you're good to go to the school-based. Along with that, one of our more popular programs is our school-based programs. So at Rideauwood, we have a youth young adult counselor in every single a OCDSB high school in the area. There's always someone there, and there's, I think, about 9 or 10 on the team, and they are constantly rotating and going to all the schools in the area to help support and meet kids in a space where they may already be attending. This is just another way that we could find to reach out and connect with these people who may be struggling with something and maybe don't have the time, maybe don't have the means or the transportation to get out to a virtual appointment or to see us in person. It's just a way to connect and foster that positive relationship around counseling. It's one of the most I say most sought after and most recommended that we have simply because we know so many young people are attending school, even if they're maybe not being classes, they're going to school, they're being around friends and having that social aspect and having someone available to talk in a place like that, we found to be very key. It is all individual counseling and varies between weekly and biweekly sessions depending on the need and what's available. But all information for them can be found not only on our website, but also through most of the schools that are available. Most of the staff admin do know that there is a counselor in the schools. On top of that, we also provide the RPEP program, which is presentations that happen around the whole year given by the same counselors about responsibilities of what's going on with substances, technology, addiction, all that kind of stuff, and how to safely use and make healthy choices. It's a great little presentation. We've all probably had something similar given to us in the past. If you all remember the DARE program, things like that, it's something that's taken a similar idea lens that works, but adapting it to the more modern modalities that we use at Rideauwood. Okay, we can go on to CHEO. This is my bread and butter. This is everything I was brought on to do, and I love the work I do. So about a year ago, the neurodevelopmental health department at CHEO had identified that there was a need to have an addictions counselor present for this program. So the neurodevelopmental health department, which was formerly known as the autism department, works with youth who are presenting with any kind of neurodevelopmental disability. That can be anything from autism to ADHD to along the whole spectrum of different pieces that are there. And we recognized that there is a need to have addiction-specific supports for these youth as well, because there are behaviors that are elicited and brought up in their day-to-day life that can appear to be a part of that neurodevelopmental disorder that they may have, but also could be a factor with addiction, and helping to identify those markers and prepare, inform, and give out any information that's needed first was identified as a key piece. So for about a year, I have been specifically working with the two programs within this, the ENS, the Extensive Needs Service, and URS, which is the Urgent Response Service, to help support these kiddos who are going through challenges with addiction and are struggling with neurodevelopmental disabilities. This takes a very different approach from our standard idea of counseling, whereas we all kind of have this idea of we sit down, we do one-on-one, and we talk about our thoughts and feelings. We understand that with some of these neurodiverse youth, it might not be the same. And so counseling looks very different and very much focuses on small steps and small wins to get us to the end goal, which is something I preach in all of my counseling anyway, but it's something we specifically focus on when it comes down to these neurodiverse youth, because it is something so volatile and so different for them to be experiencing. I will also say that a lot of the time that what we see here is a lot of technology addiction. Because substances usually aren't a piece that are as present, still is, but more or less we're seeing a lot of tech use here. They have some great resources on these programs. If you find that anything could be linked to it, you can access them through One Call, One Click, and through their website at CHEO. I've got the link on the screen there, but through CHEO, searching up their ENS program, those pieces can be found, and they are a great service. One more, Amanda, to my final piece I get to talk about, which is where we are now. Since identifying this need with the NDH department, we have also come to realize that many kiddos were slipping through the cracks of needing substance use support, but weren't finding the correct ones to connect to. CHIO had some supports in place, but they were very minimal, and they were looking to expand and find ways to support these youth who are coming in, may not want to have counseling, may not go the extra mile of reaching out, and also supporting some of those parents who are struggling with managing these youth who are dealing with these substance use concerns. And so with that, a couple of doctors at CHIO came together and said, we need to find a way to enhance this and make sure we're catching all these kids who are coming through. So we created a wraparound service that allows for first contact as soon as a youth might come into the hospital for any condition or any concern, if they are identified as someone who might be at risk of having a concern with substance use, that they can get in and see a substance use counselor immediately to identify if this is something they want to pursue, and if not, it can be hands off. But through that, we're able to provide referrals to providers all around, provide addiction counseling one-on-one to these kiddos, either inpatient or outpatient, depending on if they are admitted to different departments within the hospital, as well as helping them with some care coordination around knowing what services to access. On top of that, we also have started to offer parent support and psychiatry consultations for all of these kids who come through. And very recently, we've also incorporated French and English services, which we partner with Le Cap to help provide those French services. It's been one of our most sought after programs and has really taken off and gone very, very far, very, very quickly. And we're doing everything we can to keep up with our demand. And if ever there's an immediate concern, our always big thing is to contact CHIO 911, whatever might be the most relevant. And there are definitely places that can help with that connection. And that's why we created this program, so that there are people who were there to help reach out and support. And so it can be accessed through One Call, One Click and asking for the substance use health program, or just stating that there is substance use concerns and we're looking to talk to someone. Either youth or adult can refer into the program, and then we have our whole flow of how we get that youth connected with a counselor. No guarantees, but usually within about a week or two at the moment, just because of where we're at, and finding them the best way to make sure they have a positive interaction with their first time with counseling. And of course, if you do have any questions about these programs, please feel free to put them down in the Q&A spot, and I'll happily answer anything that comes up. But all of the answers as well can also be found on CHIO websites or through One Call, One Click. And then with that, I believe I can pass it off to Spencer to finish off with some family and parent stuff.
Yeah, thanks, Connor, and thanks, Amanda, for setting me up beautifully there. At Rideauwood, we offer a bit of an array of family and parent programs because at Rideauwood, we see folks with various needs related to substance use, behavioral patterns of use, or even like the related mental health pieces and challenges that come along with it. Starting off, we have our Family Spiral program. This is most people, or most family and parents anyway, first point of contact with our services. It's mainly a brief 2-evening long education program. We run it every 6 weeks, and it's open to parents, families, support persons, and caregivers who are concerned about an individual's problematic usage patterns and want to learn more about how to support, what to do, where to go. It's a really kind of all-encompassing kind of one-stop intro into Rideauwood and also the community of services that are around us. I say it's most people's first point in contact, but I'll get into that in the next slide. Because coming up next, we have our Rideauwood Education Support and Empowerment Training. That's our Family Reset. We love acronyms at Rideauwood. But this program is a bit of two things. It's group counseling in that we provide 8 bi-weekly group sessions on focusing on selected topics. I just ran one from 11:30 to 1 today. We were talking about setting limits and healthy boundaries. We also, in addition to these groups that we run, we also have individual counseling available for all of our Family Reset clients because we understand as we go through these topics and as they go through their own journey with their loved one, certain things might come up. Situations may arise that they need that little bit of extra support with or to talk to someone about. And I'm one of the 4 counselors on our family and parent team. I do service around 20 clients right now. I'm always Well, I don't want to say always, that's a big promise, but we are currently accepting more. Our wait list is not too long for the reset program as of now. Um, but just so you are aware, those are kind of our more standard programs. And in the next slide there, similar to the adult stream, we have a urgent substance use treatment program for families and parents. Now, this is for folks who may be in more high acuity situations, who may be dealing with more critical pieces like housing precarity, risk of being unhoused or homelessness. They may be going through like overdose crises, multiple hospital visits. So for these, this is a bit more of focused individual counseling sessions, one-on-one with one of our family and parent counselors. So there's that stream available as well. That is a 20-week long process in the USUT program, and that's the pacing can be decided largely by the client based on their needs. Some people may need to meet weekly at the start and then move to bi-weekly. Something might come up along the way. They may want to shift back to weekly meetings, and we're really there to help tailor that more complex support in that program one-on-one with our clients. And that kind of brings us finally to the last stream there. That would be our Smart Recovery for Friends and Family program. Now, this has been something we traditionally have run in the past. COVID has caused a lot of changes to our programs. Um, but we will be restarting this in January, and this will be open to community members as well as current clients in providing weekly support and tools for family, friends, and caregiving persons and supportive persons in a bit of a peer support group setting. Less directed and more kind of focused in bringing everyone's perspective together and helping support each other through our collected wisdom. This is, again, with a lot of our other programs, it's very solution focused and self-empowering focused. We work through that lens very largely. And if you folks are interested, you can always reach out to our main office line or Amanda Neilson or our other points of contact and ask for more about that. But that will be coming mid-January. So just so you're aware. Um, we would say that we have a few best practices for parents that we like to share about as well. Um, and this really ties into everything we were already talking about from that harm reduction, that trauma-informed approach, you know? And we really want to make it about more than just the addictions issue. And the first point in there is creating more opportunities, looking out and expanding our horizons, prioritizing youth involvement in any activities, especially ones that they are already interested in, passionate about, or maybe open to engaging in. And we also look at ones that build skills and qualities that, you know, we find from research might make them less likely to engage in substances in higher risk or problematic ways, simply because they might have other pieces working for them. Also consider the benefits of hobbies and activities in preventing use and adding to overall well-being and development. Again, these are ways sometimes that people can meet some of their fundamental needs, such as connection and some of that autonomy. Um, Dovetailing on that, we talk about a lot of boosting youth connection, and specifically early on. And so I'm just going to take my glass of water. Oh, I feel like I've been talking for 10 hours today, so apologies for that. But we like to really emphasize that the earlier we can start building these connections, the better. And hey, if we're coming into it a little late in the game, that's fine too. It's right now is the second best time to start. Because we really find that with a lot of these situations, the connection is the correction for a lot of folks. Finding those sources to really feel understood, to feel known by other people, and really building those connections with both family and wider circles like peers and community and mentors is key as well. Um, and kind of on the note of empowering young people, we want to look beyond saying no. We want to empower young people, and this is part of the school-based program in what we deliver to classes in our prevention and education programs, giving youth the best possible information from the research and best practices available to us, and helping them feel more confident and have more information to make meaningful and, well, hopefully healthy decisions for themselves in their own lives. As they gain experience and as they gain these skills, these 3 points all come together for us in our work a lot of the times. And for yourselves as perhaps parents, caregivers, older siblings, friends, whoever you may be in the audience tonight, talking about substances and sensitive topics like technology or phone use and screen time neutrally. This means without judgment. We can acknowledge some of the positives, like Gabor Mate was saying. We can say that, yeah, there are some reasons you're probably engaging in this. And, that's valid. But also adding in, there's two sides to that coin. There may be some negatives that go along with this as well. But making it not necessarily all negative opens it up to a little bit more of neutrality and exploration, as opposed to the kind of tug of war effect where we find people maybe digging in their heels in repeated arguments. There's a common example with long-term people smoking cigarettes is like, well, they probably know about the health risks themselves as well, but there's probably some other reasons why they're doing it. They're getting something out of it that's not just all the negative stuff that we already know. So trying to explore those sensitive subjects with a little bit more nuance. And as we bring in technology, and this isn't written down here, but it's mentioned, it's really figuring out our loved ones' relationship with technology. Because especially in this day and age, it's very hard to make an abstinent or take an abstinence approach. We find it's a lot about how we have our relationships with our devices and how we kind of are able to set our own limits and use them in a way that helps us rather than hinders us. Um, so that is in a very small section, some of the best practices for parents. This is not an exhaustive list. This comes a lot from research done by the Canadian Centre on Substance Use, um, as well as other academic sources as well. But again, we are always able to open it up to your perspectives as well. If you find you have things that you would like to share with us, if you have questions over, hey, I have an idea of something that might work, we would always be open to kind of exploring that a bit as well in a very small kind of info-based space, if that makes sense. So yeah.
Thank you so much, Spencer, and Connor. So, how to access Rideauwood services. So, as Connor has already mentioned, there's one call, one click, and this is for, and I'm going to look at Connor for this. Is it up to 18 or is it up to 16?
It's up to 16
Okay.
sessions of support.
Awesome. So for folks that are 16 and under, you want to access one call, one click. For 16 or 17 and above, access MHA. So these are regional coordinated access points where if you're interested in service, you call them, they're able to do support and assessment and then make recommendations. And they include what you are also looking for. They'll let you know what services are available, what the wait lists are, and support you in getting in contact. We also have the ability here at Rideauwood that should that not be either accessing technology doesn't work or it's not accessible in any way, then we're able to provide in-person intakes at Rideauwood, and it would just require a call to our front desk. And so with that, thank you so much. We definitely have time for questions. I am going to go ahead and stop sharing. And I believe that Danielle is also going to add an evaluation into the chat. This is just a brief evaluation letting us know if what we've covered has been helpful. Yeah, so thank you so much for being here with us tonight.
And thank you. So wonderful to hear all of the services that you have available to support our loved ones in the community. I do see one question, oh, two questions in the chat in the Q&A tool now. The first one asks, where do we start if we want to take the CBT training?
So I might just ask that person to clarify a little bit. So here at Rideauwood, we don't provide cognitive behavioral therapy training. We do so as we've done tonight. We do go to other agencies to provide one of the standard presentations or trainings we do is called Beyond Drugs, Understanding Problematic Substance Use Through a Trauma-Informed Lens. We've also done presentations on harm reduction, but typically these are for individual in the helping profession or their agencies. But I'm totally
And
open if that person wants to clarify a little bit more.
yeah, that would be great. Natalie, you were curious about sort of how we come through the front door. That was sort of answered in the last slide.
Yeah, it was. I think it bears repeating. I wasn't sure if any of the programs needed like a specific, like a doctor referral, or if they can all go through the Access MHA or use specifically, or one click, one call, one click if they're under 16,
Mhm.
correct?
That's correct. Sorry, go ahead, Connor.
I'll make one slight caveat to that. For the most part, that is 100% correct. And I'll correct myself. It's 18 and under for one call, one click.
Oh, great.
But the only one would be our urgent response service that is at CHIO.
Okay,
It's not specifically a Rideauwood one, but sometimes it can the lost in confusion. There does have to be a
correct.
specific diagnosis for that. But at Rideauwood, there is nothing that is
Mhm.
needed.
Perfect.
And I'll add to that, this school-based program, parents are concerned, loved ones don't have to go through one call, one click. It can be highlighting it with the guidance counselor or the VP at the school to be able to have that student connect with the school-based counselor. And I'll also note that this is also a service for youth who are concerned about other people's use. So maybe they're not using problematically or they're not using habitually, whether
Mm,
it's substances or technology or gaming, but they have a sibling who is, or they have a parent who's struggling. And so all of our school-based counselors are also trained at being able to support youth as loved ones.
That's awesome. So we often with ONBPD get asked, do we have to prove we have a loved one that's been diagnosed?
No.
So it sounds like on your side, if they're concerned about someone, it's not like they have to say they're currently being treated for addiction.
Mhm. That's right.
That's great.
Danielle, would you like to read the next question?
Sure, yes. So the next question is, considering that this webinar is sponsored by ONBPD, are you aware of any specific BPD or neurodivergent mental health addiction services for youth between 18 and 25 years old?
So I'm noticing Connor. I'll do my spiel and so that's us. So that's our youth and young adult program. So between 18 and 25. So it is, give me a second. Get excited about this stuff. So we at Rideauwood have an understanding that a, a youth isn't walking down the street minding their own business and all of a sudden they have a problem with substance use. We understand that substance use from a holistic point of view. So what does that mean? It means that we work with students with a variety of mental health concerns, issues, diagnoses, but they don't have to be diagnosed. Um, so we support, we provide treatment and counseling for folks who are experiencing problematic substance use and other related mental health issues. So though we wouldn't specifically see someone who was just experiencing symptoms of PBD, and not have any substance related concerns, if they had substance related concerns and they had BBD, they are absolutely part of our mandate or people we treat. But Connor, maybe you want to speak. And Spencer too. Both Spencer, myself, and Connor have all been on the YYA team at some points in our careers. So a wealth of information and expertise here.
So when it comes down to these youth aged 18 to 25 who have those specific concerns around mental health, exactly like Amanda had said, it's not that we are necessarily treating specifically those disorders. We are there to help treat and support the addiction or substance use disorder that's there. Um, However, there are other resources in the area that do support specifically the mental health if that's what you are looking for, and there are different programs and options that are available. So one of the ones that we work closely with as on the youth and young adult profile is Dave Smith Youth Treatment Center as a place that can offer not only support for addictions in a live-in capacity, but also does do a little bit of work around the mental health. Not a lot. They do focus primarily on addictions, similar to us. There aren't many programs that offer a very concurrent disorders program. The only one I'm really aware of is at the Royal, and they do have both an inpatient and outpatient options that are available especially when there are diagnoses involved, and they can even help with some of those further pieces as well.
Do you have any partnership with the Royal?
Rideauwood, not specifically. However, CHIO does, and so there are bits we go back and forth with them, helping support youth who are 16 and up can go to the Royal. And so CHIO does link up with them once in a while. And I have many clients who go back and forth between our services as needed, or do referrals and transfers that are there.
Okay, thank you very much.
And maybe just to confirm, so if we have a loved one who has a mental health diagnosis like BPD or something, also has substance use, that that wouldn't prevent them from attending Rideauwood programs, right? You're comfortable with dealing with folks who come through with concurrent disorders. Yeah. Natalie,
Spencer, did you want to speak to that?
Yeah, I just kind of echoing Connor's point. I did see a few youth go through the kind of transitional age youth service at the Royal Rapid Access clinic. It's usually for the more significant or high acuity stuff, mind you.
Mhm.
But there might be many programs depending on what that need specifically is, like whether it be outpatient or inpatient, whether it be more intensive versus just once a week individual counseling. So there may be some options in there.
Natalie, would you like to put the next
Sure.
question?
Yeah, we've got some more coming in here. What is the best language to use when sharing resources such as this to someone else? I think we can extrapolate from that, probably like in a sensitive situation, or maybe there's anticipation of defensiveness. How would you suggest someone go about introducing this idea?
That's a great question. This is something I see a lot with clients, especially when folks feel like they're maybe walking on eggshells or really worried about the reaction from the other person.
Mhm.
So finding a way to add a bit of like the neutrality goes for the subject, but also for the space and the timing itself. Now, we would say that probably we don't want to come in and say, "Hey, you need a service. I have something for you. It's something you need to deal with." We're really trying to just kind of remove the accusatory and just add a bit of what some may call a bit of a buy-in. Hey, I heard about this service. It might be helpful for, these things that I am aware of, and not assigning it to the other person, just saying, hey, they can help with these areas, and there are people to support and talk to if anything related to sensitive subject A, B, or C comes up. Um, a lot of it is in what we call couching too. And I don't want to go too far into this. I could talk for an hour about how to bring things up and broach subjects, but having the right time and space to engage and share the resource within, right? Like if my loved one is actively in the middle of a game, I see their shoulders up, their eyes are keyed in. I don't want to approach them and say, "Hey, I'm trying to sleep. I was just wondering if, you've thought about calling XYZ number.
Yeah.
It may be finding a time where people, you and the loved one, are both in a neutral or good mood. There's not already something going on. There may be lower stressors in that day. And again, avoiding those creature moods of being hungry, tired, or cranky or sad. Um, but yeah, I hope that's helpful as a bit of a Coles notes in how to share these resources, and maybe some of my other panelists can chime in, but that's kind of what I have in a short form.
Yeah,
Sometimes I just share them on my own Facebook, and I know that people in my circle might see it. And or I don't know about you guys, if you ever search for anything on your phone, all of a sudden you're getting these things. Like there's ways to share messages outside as well a little bit. Sorry, Amanda, you were going to say something else.
No, no, I appreciate the discussion. And one of the things we often encourage if you are a parent is the role modeling. So often that family spiral that Spencer was talking about can be so helpful. So you see your youth or your young adult, and you really you need to go get that service because, of course, you want the best for them. You want them to be well. You want them to be happy. It's so hard to see them suffering. Um, and so, what we know from the research is that the more family members that are involved in having a trauma-informed understanding of problematic substance use, an updated understanding of substance use, who are able to, because Family Spiral is not only about education on like how to support a loved one, but it's also education and support on how to support ourselves because it can be quite the roller coaster and it can be quite polarizing between fear and anger and back to fear and to helplessness. And so the more folks, if you have someone in your life, and again, actually, whether it's a youth, young adult, or an adult that you have concerns about, being engaged into some of these services, specifically, I can't recommend Family Spiral enough. It is a low barrier. It is not group therapy. You don't have to participate if you don't want to, but it's plenty of support. And we just see that how that can support people from coming from a more neutral place of being able to be grounded, even though, of course, it's natural, normal to feel the fear and the anger and the helplessness. But that's often not the place we want to, as Spencer was saying, it's often not the place we want to come from when we're suggesting services. And then you can speak quite, hey, I attended this thing at Rideauwood, and it was really helpful. And they have some programs that might be helpful for you too. It can be very tempting, and as loved ones, we are trying to manage our own emotions. We're trying to manage our loved ones' emotion, plus a job, plus this, plus that, right? That it's like, well, I don't need the treatment. They need the treatment. And right? And like, oh, so much compassion, right? Of like, oh, if they could just get help. But we know the more people that are involved in, the more people that are able to be healthy and grounded, that change happens more naturally. It's almost going slow to go fast, right? Sorry, Spencer.
No, that's a lot more eloquently said than I could have put it at 8:06 p.m. But I will also just quickly plug our next Family Spiral dates are the evening of December 4th and 11th as well, if folks just were interested.
It's great to know. There is a comment here that Dave Smith's program ends at age 21. It looks like you're all in agreement with that. And then there's a question about how long the wait list is for adults at Rideauwood.
Long. The short answer is long. So unfortunately we are small but mighty. We have approximately a year-long wait list for our group programming for adults. And so what I will say is Vicky, who's our brief counseling and triage intake person. She does an excellent job of really supporting people and finding services while they wait. So again, this is not for the adult programs, with the exception of the urgent substance use treatment program that I believe is roughly, it varies depending on demand, but is roughly anywhere between a month to 2 months, where our adult group programs are 12. I wish I could make that way more lovely and positive, but unfortunately, as a small nonprofit, we are limited.
Just for clarity, so that second program you said, there's a separate question here about is there a wait list for youth, like 16-year-olds?
Mhm.
Was that your second answer, or?
No, but so that was specifically, so the adult group program is 12 months. The adult urgent substance use treatment program is between 1 month and 2 months, and I'll pass it on to Connor to speak to the youth
So within the youth program, we do have the same breakdown as the adult program has. So we have our regular YYA program and we have the USUT program. Our USUT program, which is for urgent and usually much higher risk scenarios, is about 2 to 3 months for us right now. And then our YYA youth program is anywhere between, I think it's between 5 and 7, as again, as Amanda said, we are small but mighty. We do usually recommend that for their substance use right now, because of the lengthy time of the wait list, that accessing the One Call, One Click list and going through the CHIO Substance Youth Health Program, we have more availability there to help bridge in the meantime. So that's why the whole service was created, because we do recognize that we are one of few free services for that. So you can always contact and get on that wait list, and then you are more than happy or welcome to also reach out to One Call, One Click. And reaching out to One Call, One Click, they will put forward the referral to Rideauwood as well if it's on offer, but they will always default to the CHIO program that is available there. But for Rideauwood specifically, about 5 to 7 months, give or take, is the average wait list.
Okay, thank you. Danielle, did you want to ask the next question in the queue?
So the next person has a parent struggling with BPD, addiction, and suicidal ideation. Are they better off trying with the Royal rather than Rideauwood?
Great question. So I, I I can start us off if that's cool, and then I'd be curious about Spencer's answer as well. So, I'm going to give you the most social worky answer ever, and that's it depends. Right? It depends on the acuity of if they're needing to have contact with the hospital, if they're needing psychiatric supports, which we at Rideauwood don't provide, but the Royal would, with the concurrent disorder program, as was mentioned, that there's inpatient as well as outpatient. So it depends on the acuity of symptoms. It depends on what they are looking for and needing. So suicidal ideation, we support folks with suicidal ideation. Again, that is not an exclusionary criteria for our services. But if they are needing more intense care, if they're needing that access to a psychiatrist, then yeah, the Royal is going to be able to provide more of that service than we are. So I appreciate that question, right? Because um, most services aren't everything to everyone. And so, yeah. Spencer, I don't know if you have anything to add.
That pretty much covers it. Just the note that we don't do crisis counseling. We're more for the ongoing recovery support and dealing with things as they come up. So sometimes I tell clients it's good to have a few services kind of in your back pocket, like distress centers, emergency contacts, and then in the lower acuity, as the dust settles, getting on those wait lists for intensive programs, getting your own counseling with a family and parent counselor. Those are all things that may be helpful depending on your needs or your parents' needs in the moment in the situation. I hope that's at least
Well
a little
said.
helpful.
Yeah.
Great, thank you very much.
Natalie, would you like to ask the next one?
Yeah, and I do appreciate that extra call out on the crisis to make sure that they understand where to go. Next one is any video game addiction treatment.
I think that this is probably directed more towards me. It's definitely something we've seen more in youth and young adults comparatively to adult programs. Rideauwood is one of very few that does offer a video game and tech addiction
Wow.
services. There are not many, because it is still in this early stage of recognizing and identifying how we can support and treat video games and tech addictions. And so it's something that some places just aren't touching. So for example, the CHIO program will deal with all substance use, but won't touch any of the behaviors at this time. So Rideauwood is there and we can support with that piece. Yeah, through any of the programs. I believe the adults do as well. It's just a little less common. And then, as Amanda had also mentioned, we also have the gambling program, which offers a very similar style when it comes down to behavioral addictions.
Great, thanks.
Danielle, do you want to ask this last one?
Yes. So, how do you access the Spiral program? Um, hello.
Yep, we've got you. Yep.
Okay. I'm seeing completely black.
Oh
So,
no, we got you. We can even
okay.
see you. Yeah.
Okay. I don't know. My screen just went dark. So is it through Access MHA or by direct contact? How do you access the Spiral program?
I'm looking at Spencer, but he can't see that I'm looking at him. I do believe for our family spiral, it's a direct call. Is that correct, Spencer?
Yep, calling our main office is the best and most direct line. I'm almost positive Access MHA refers to Reset and USUT, and they recommend folks go through Spiral, but they won't automatically sign folks up for Spiral. That's another step, but it's usually just a simple call or email, and just asking and saying just, hey, I'm interested in Family Spiral. Can I please sign up? And just providing your name and contact info. So yeah.
Okay. Thank you very much.
And then we have a question, can a client access the group program if they've already done it once? How long do they have to wait before they can take it again?
Great question. Going to be social worky. It depends. However, so folks can re-engage in our services. So I'm guessing this is for the adult group program. We do have folks that will come back, let's say in a year. Um, if a person were to go through the program and they're like, "Ooh, I want to do this again," we would work with them around like what are they hoping to get in doing it again? Is there a service that maybe in between? There usually is a period of waiting period before we would allow people to access, not allow people, but we just get curious, right? We just get curious because we also want folks to be able to go and use the skills that they've learned to experience life as they are practicing their goals. Um, and certainly, like, I can appreciate, I just finished a pretty intense training and I'm like, I need more. And that was my natural, normal reaction at the end because I got so much out of it.
Mhm.
And that there are lots of benefits of like, okay, being able to go out and practice and work with that. So certainly if a client has accessed our group program and it's been a little while and they're like, hey, that was really helpful and I could use some more supports, then by all means we would encourage folks to go through Access MHA and re-engage.
Nice.
Yeah.
One thought occurs to me. I was really struck by your description of your family programs and how changes in the family can affect the person struggling, right? And definitely that's kind of a proven point around family connections as well. We see if the families learn to regulate themselves, then people with BPD somehow better often have better outcomes. So I'm curious if I'm a parent with a child with BPD and using substances, would you recommend us both to come in parallel, like access the family program at the same time as the child, or one in one particular order, or how would you think about that?
Go for it, Spencer.
Yeah, I'm glad you brought that up, Floyd, because this comes up a lot, and we ask that parents sign themselves up, but not as a spousal team, if that, or a parental team, if that makes sense.
Okay.
Um, because they'll be assigned their own individual counselors, and that counselor will be different for each individual, just based on like staying objective and like the conflict of interest pieces. But
Yeah.
um, we would also encourage that, and we really do not restrict if both caregivers, both supporters, wanted to hop on the same reset group on the one monitor, we would be
Sure.
totally fine with that. We have that as well. But we just ask that it gets a little tricky that when they're attending, that they really try and separate and keep their own pieces for themselves. It's just that we've had issues come up where, for instance, there were two folks who couldn't both join the Zoom link at the same time because their internet was unable to. So we'll always work with that. We just prefer that for just the way we run our service, that we just prefer to see individuals just one-on-one, and we prefer like all families are kind of getting service, or all family members are all working in their own capacity in their own services, but still not doing the exact same thing together in the same setting, if that makes sense.
And I'll say, thank you. That was a great reminder, Spencer. I will also say that we, as part of our intake, we will ask, do you know anybody who is also applying
Mhm.
or in group, or because we do try to prioritize if we know that a youth is, seeing Connor, well, and like specifically, actually, there's family in the program that Connor's in. There are family counselors that are working at the same time. I will speak for the general program. If we know that, let's say, youth is seeing a school-based a counselor and a parent is coming in expressing that they'd like to be part of the parent program, then we will prioritize getting them in sooner.
Very nice.
Yeah.
Thank you. Uh, One last question here. Is the reset in person?
No, our reset is held virtually.
Okay.
However, it's important to note that Family Spiral for December 4th will be in person, but
Ah,
for January and the winter months after, it will be virtual as well.
maybe one last question from me, and that is, we often hear about readiness for change topics with our, families who have tried to refer their loved ones to counseling or, for any service. And sometimes, our folks just aren't ready. And I wondered if you have a perspective on that to share.
Yeah. Do you mind, Amanda, if I just kind of hog the microphone, as it were? Um, yeah, it's really hard, especially because I find the readiness for change can be fleeting, or it can happen in one session and then the next session there's a big backslide, and there can always be new pieces coming out. But we do work within like a stages of change model as well, just
Mhm.
for full transparency. And we really like to tolerate a lot of that ambivalence. Because that complexity comes along with the nature of habits, with addictions, of addictive patterns and behaviors that people are actively working on, right? Or ambivalent towards working on. We really want to find the pieces that the caregivers in the family and parent program can focus in on, and kind of work on those small pieces before tackling the bigger issues when it comes to like the readiness for change and the bigger pieces of change to move, if that makes sense. But that is that is a great question. I'll also turn it over to Connor because I notice he has his hand up.
So I echo literally everything Spencer has said, and I will also add in the lens for if we're trying to support a youth who is looking for change. We know that during the teenage years, our brains flip-flop a ton. They go back and forth between wanting to do something and not wanting to do something. And so we always highly encourage even getting some piece started. And if it's a struggle to really get them off that ground floor, getting that first connection is usually a good way for us to establish that piece. And that's, for example, why we created the program at CHIO, because it allows for a space where we can have a positive interaction, and then that can lead to further and further and taking those small steps, exactly as Spencer said.
Amanda?
Yeah, and then I'll add my 2 cents. So when I was working in the school-based program, I would ask the guidance counselors and the VPs, please do not ask the youth if they want to go see the drug counselor. Nobody wants to go see the drug counselor. Please just, be like, hey, follow me. And of course, we believe in consent to treatment, absolutely. But this idea of once that youth was able to sit with me, and to Spencer's point, we have all the room in the world for ambivalence.
Hmm.
Because going back to that philosophy of care, we understand that if a youth is using and they're using problematically, if an adult is using and they're using problematically, that there's some really good reason for it. And when we can sit there and ask the question of like, what is it you like about being drunk? What is it you like about drinking? What is it you like about getting high? 9.5 times we will always get back to that one of the fundamental needs. It's the only way I can sleep at night. It's the only way I can be in the house. It's the only way I can handle my kids' mental health issues. It's the only way that I can manage my chronic pain. It's the only way that I can function. And so we go, okay, what would it be like if we could support you in getting those things that don't have to rely on substances or gaming or gambling? And so even that idea of our jobs are not to make people change. Our jobs are to support people in increasing their quality of life and decreasing the risks of their use, right? And so even the fact that we can come at it from that way, we're not here to argue with them and tell them that this is what they need to do. We go, yeah, of course, that makes complete sense. Of course you would use. Of
Hmm.
course you would need to get high to manage that. Of course it's working for you. And what would it be like if we could support you in getting all those needs met, but in ways that aren't causing problems? And that's very goes back to that video we saw at the beginning tonight, right? Of like just almost like what do we need to add to help get those needs met before we focus on what needs to be taken away.
What a wonderful summary to wrap up our evening together. I am so thankful to all three of you, Amanda, Spencer, and Connor, for sharing so generously of your time and your expertise with us, and also for the vital work you're doing in our community, supporting our loved ones. I really appreciated, learning about your focus on trauma-informed care, like as you just said, this approach to just confronting that stigma that's around some of these things and supporting the autonomy of individuals. It's been fun to see how our programs complement each other. In fact, before we started here, we were sort of talking through the different approaches, the similarities and differences between what we do with Family Connections and some of the programs you offer at Rideauwood. And I noticed this common thread on focusing on connection as treatment, right? Family
Yeah.
Connections is about building those connections. And we can see how effective that is, not only for the families, but also for the loved ones. I had not heard about several of your programs, including the Ottawa Drug Treatment Court or about your work with CHIO, especially with the neurodiverse youth. So that is so cool to know. I also want to say thank you to our audience for attending this evening. Um, we will be posting the recording of tonight's lecture on the ONBPD website in a few days, so you can share it with other people that are interested. And I'd also invite folks to tune in for our next public lecture, which will be on December 11th, coming up fast. And that will feature a panel of individuals who have lived experience with BPD, facilitated by Sean Fisk. And with that, this concludes tonight's public lecture. Thank you all.
Thank you so much.
Thank you guys. Bye.
Good night.
Thanks, everyone.